Hey, welcome back to another episode of RN Cliff Notes. And today we're talking about cardiac anatomy and physiology. Let's jump right in. Okay, at RN Cliff Notes, here's what we're doing. Helping students see through larger concepts. And I'm Cliff Davis, Associate Dean of Nursing and longtime advanced medical surgical nursing professor. Okie dokie. So, you should have your paper and your pen, your pencil, or your iPad, or whatever it is you're using, right? And go ahead and write down or type in what are the 3 layers of muscle that form the heart. What are the 3 layers of muscle that form the heart? Hey, but let's add this. So you got those 3, but let's add this piece. So of those 3, which one of those layers is the thickest and is striated? Which one of those muscle layers is the thickest and is striated? All right. And you should have the following. Okay? Epicardium, Myocardium, and Endocardium. Now, if you watched the previous video, and you should have, right? This knowledge is like building off a previous video. So really important that you get the fullness of it. We talked about epi meaning what? On top. So the topmost layer, right? The outermost layer is the epicardium. In the middle, middle, myocardium, which, by the way, is the thickest and striated, right, layer of muscle, cardiac muscle. And then we've got the endocardium. Endo means inside. So many of you have heard of an endoscopy. And what happens during an endoscopy? Well, endo, inside, and oscopy, so scope. So the doctor's going to put the scope inside of your patient and take pictures and perform interventions and things like that. Yeah? So, endocardium, inside the cardiac. All right? Great. Now, what chamber of the heart receives deoxygenated blood from the body? What is the first chamber of the heart that the blood enters? And this is kind of an all-time favorite on test too. All right? And the right atrium. Yes, it's your right atrium that receives blood from all the parts of your body, right? The first chamber of the heart that your blood enters, the right atrium. Let's do another one. What chamber of the heart pumps out oxygenated blood to the body? Which one is that? When the blood exits the heart, okay, and goes to the body. That would be the left ventricle. Good job. So if you said left ventricle, good for you. If you didn't say left ventricle, shame. All right? And that's okay. It's a good kind of shame. All right? Well, you're here to get that fixed, though. No biggie. All right? Left ventricle. Now, which side of the heart is the bicuspid valve located? Which side do you think? And you say it's the... All right? If you said the left side, you are correct. All right, good job. And let's do this one. Which side of the heart is the mitral valve located on? And you say the, okay, let's hope that you said the left side again, right? Because mitral is just another way of saying bicuspid, by the way. Heads up. Okay, let's go back to this one. So, mitral valve. If you went to Home Depot someplace, rented a miter saw, right? What would you do? You take a 2x4, put that under the miter saw, cut it. That one 2x4 would turn into 2 pieces, right? So splitting into 2 to miter something. By the way, here's another one. If you've ever seen a pope wear a miter crown, at the top of that crown it looks almost like a fish's mouth opening up. It's splitting at the top. It's what? Mitered, splitting into 2. So whether we say bicuspid, referring to the cusp, or leaflets or flaps, or we say mitral, we're referring to what? Splitting into 2. Good. Now, left side, as we know. Which side of the heart is the tricuspid located on? And you say... And some of you, after you think about it, you got to think of sayings and say, This easy. Here you go. Super easy. Right? Right side. Why? Because we said tricuspid. And all we need to do is this. Rearrange these letters. Take tri and do what? Spell it R-I-T instead. And where's the tricuspid? On the right side. That's how we do it here. This is our Cliff Notes. We study what? Smart. All right. Moving on. Number your paper or your device from 1 to 20. Go to it. Yeah. We're about to do probably the biggest quiz on YouTube, huh? 20. I like that number. That's a good solid number, 20. Oh, by the way, it won't just be 20. We're gonna probably keep adding to this thing. If you're in my class, you know it. You know the deal, right? My quizzes, they keep growing. Next thing you know, we're at like 30 or something. Right? Yeah. So 20 won't just be 20. It'll be 20 A and B. All right, we'll get there. Okay. So here we go. And boom. That is fantastic, is it not? Yes. Nice and colorful, big clear numbers. Go for it, right? Do your thing. Do your thing. Now, there's some of you that look at that thing and you just like, oh, I'm not feeling all that in. Like, yes, you are, right? Go for it. You can do it, right? You can do this. All right. So you look at the picture. What do you see? It goes up to 19. That's because 20 A and B will be on another slide. We'll get that done. All right, so here we go. Boom, there we go. 20 A and B. So what you need to do is determine which of these vessels carries oxygenated, deoxygenated blood, or both types. Do they carry deoxygenated blood, oxygenated, or both? And the answer is veins typically carry what? Deoxygenated blood. However, when we're talking about the heart, right, and pulmonary circulation, we need to study the heart backwards. So what I teach my students is to cross their hands when they're studying the heart. Why? Because typically when you're looking at the heart on something, you're visualizing the heart as if it was inside of your patient's chest, standing before you. So you need to take your hands and do that. It's going to help you situate right from left. Okay? Now, that's just right and left. Also, when we say pulmonary, the vein in this instance, it actually carries, right, oxygenated blood because it's pulmonary circulation, and it is what? Backwards in a sense. So pulmonary vein carries oxygenated blood. Pulmonary artery carries deoxygenated blood this time. Yeah, because it's pulmonary circulation. Otherwise, it would go back to the normal rules. Okay? What other time in the body does this happen? Where the vein and the artery switch roles. Let's make that 21. What other time in the body did the vein and the artery switch roles? And that would be umbilical circulation, right? Woman pregnant with a fetus, and the umbilical cord would have arteries, veins, and so, right? Let's make that 22. Okay, so 22, how many arteries, how many veins in the umbilical cord? And here's what you do. You just remember that mom's name is Ava. Ava's her name. So artery, vein, artery. 2 arteries, 1 vein. Yeah? Check that out. Okie dokie. So here are our answers. Hooray, right? What a relief. So 1, what's that? Superior vena cava, or SVC for short. Let's pause for the cause here and get you some higher level knowledge, right? Because there are many of you out there who are studying to be RNs, or you're studying to be a nurse practitioner, or a nurse anesthetist, and it may be your job one day to remove a central line. So what happens? You look at the progress note that the doctor made, and it should indicate how long of a catheter he inserted in the patient's body in order to get the tip of the catheter in the patient's SVC, superior vena cava, right? And that's typically measured in centimeters. And those centimeters are marked in whole numbers, and in between those whole numbers, you have a little dash. That little dash or that little dot represents a half. So, if the doctor has in the progress note that there are 30 and a half centimeters worth of catheter in the patient, and you see that in the progress notes, if you're the nurse removing that central line, you need to make sure that you take out all 30 and a half. If for whatever reason you were to pull out 28 instead of 30 and a half, what does that suggest? There's 2.5 centimeters worth of catheter still left in your patient's circulatory system. And you need to contact the doctor and let them know, right, that what are we doing next? Our next stop needs to be angiography. That patient needs to go for a foreign body retrieval, right? And we need to go in there and get that foreign body, which would be the catheter tip. Okay? Good, good. All right, so moving on. So we got our SVC out of the way. Then 3. 3 is these two red ones. Oh, no, we did SVC. We need to get 2. 2, pulmonary artery. So what are we doing? Crossing our hands. And, right, pulmonary artery is coming up like this and splitting into 2. And we crossed our hands. And that is the right pulmonary artery, followed by the 2 reds there, which is the pulmonary veins, and that would be the right pulmonary veins. All right, and after that, we've got 4, which is pointing to the pulmonic or pulmonary valve in that picture. 5 is pointing to the right atrium, and we said earlier, the right atrium is the part of the heart where the blood, once it returns from body circulation, right, and needing oxygen, that's its first stop when it goes into the heart. Then from there, right, 6 is pointing to the valve here, which would be the, what's the name of that valve on the right hand side, right? You guessed it, tricuspid. Yes, good. All right, then after the tricuspid, the blood circulates to the right ventricle. So that's what 7 is pointing to. Then now, we wanna make note of 8. And 8 is the IVC, or the inferior vena cava. But follow the terms. When we're talking about vena cava, it's what? Superior and inferior vena cava. SVC, IVC. Okay. Now, number 9. Number 9's coming off of the aortic arch, right? And that's also a piece of coming off of the ascending aorta, right? But we'll get to that in a minute. So, you got your BCA, LCCA, and the LSA. So, your BCA, your brachiocephalic artery, and your LCCA, your left common carotid artery, and then you also have your LSA, which is your left subclavian artery. Yeah? Okay. And all of those are coming off of your aortic arch. Aortic arch. So, 10. Good. 10 aorta. And again, that's looping from the, or going to the ascending, right, aorta. And 11, cross our hands, talking about the pulmonary artery, but which one? The left pulmonary artery. And then 12, the left pulmonary veins. 13, the left atrium. And then we've got 14, the mitral valve. What was the other name for the mitral valve? Good, bicuspid. Bicuspid valve as well. Good job. After 14, or the mitral valve, we've got 15, which is pointing at the aortic valve. All right, super. Then 16 is pointing to the left ventricle. Earlier we said the left ventricle is the one that part of the heart that has to do like the vast majority of the work. It has to pump against your body system of arteries. And arteries are like really loaded with muscle. They are wrapped tightly with muscle. So your left ventricle has to work really hard. Okay? Then now, so 16's left ventricle. 17 is this little space here separating your ventricles and things. And that space separating your ventricles is separating. Catch that, separating. And that's called the septum. The septum separates, right, your ventricles. Good. 18, I added 18 for good measure. You know, because we're talking about the heart being, you know, so we're studying the heart is backwards, right? So 18, notice that the apex of the heart is where? At the bottom of the heart. And that's going to become important later in the videos when we start talking about pulse points, right? So when we're auscultating a person's apical pulse, right? We're auscultating that where? At the apex. Apical, apex, right? Yeah, that's where we're auscultating at. Then now, 19 is not shown in this one. However, 19 over here is the descending aorta. So we've got descending aorta, right? Ascending aorta, catch the terms. Descending and ascending aorta. But when we said vena cava, right? It was superior and inferior vena cava. All right. Then, all right, mosey on. So we've got here what chamber of the heart receives blood from the body. And we said, what was that again? I think we just got ourselves a little reminder here as we go out. So receives blood from the body, and it is the right atrium. Super. And let's see. What else we want to know? What side did we say the tricuspid was on again? It was on the what? Right? Tricuspid's on the, right? RIT, on the right side. Good job. Good job. Hey, all right. Thank you guys for subscribing and liking. I really appreciate it. And keep studying smart, guys. Keep going. Thank you.